Everyone, good afternoon. That is, thank you for joining us for our Thursday COVID-19 briefing. Our efforts to get out as much information to Tennesseans as possible as we attack this COVID-19 virus in our state. We want to keep you informed of where we are, of the progress that's being made, of what people are doing all across this state, including every Tennessean, to make sure that we mitigate the spread of this virus in our state. Before we get started today, I just want to thank a particular group of companies, an industry that is making a good faith effort to support Tennesseans during this uncertain time. You know, because Tennesseans are doing their part and staying at home, the number of drivers on the road has plummeted, and also the number of accidents has plummeted as well. We're seeing significantly less accidents, and I want to commend auto insurance carriers, many companies across our state, for returning savings directly back to Tennessee customers. Many companies are doing that. We've heard of reports of that all across the state, and we're grateful to the auto industry for what it's doing to help Tennesseans. We're all in this together. Today we have 4,634 confirmed cases of COVID-19 in our state. We have lost 94 Tennesseans to COVID-19, and 921 cases have recovered. Our team is working very hard, diligently, daily, to make sure that every community has access to life-saving personal protective equipment. You've heard me talk about that many times. To date, our Unified Command Group has made more than 1,300 shipments of PPE to all 95 of our counties, many of them on multiple occasions. But we need to continue this effort to procure PPE, as we know that there are shortages all across the country. So yesterday I signed Executive Order 25 to ensure that our efforts to gain that much needed personal protective equipment will continue. The order extends previous actions like keeping dental clinics closed. It also covers all procedures that are elective, non-urgent, and can be delayed until after April 30th without risking serious adverse consequences to a patient. Today I want to also talk a little bit about what we're doing in education, a very important subject to every Tennessean that has children that have been in school, and to every Tennessean that cares about the future of our state. Today, Tennessee Department of Education Commissioner Penny Schwinn has joined me. I'll have her up in a few minutes to give an update on what we're doing in our state with regard to education. You know, COVID-19 has disrupted the lives and the livelihoods of Tennesseans all across our state, and our students and teachers in particular have faced disruption. Parents are serving as educators at home, and I empathize with the pressure that parents face as they make attempts and efforts and work diligently to make sure that their kids are getting educated while they're not in the school building. The Department of Education's work to provide resources for all levels of learning as we navigate in this unprecedented time when kids are not in school. The department worked out a partnership with PBS stations across the state to offer 1st to 8th grade students up to 30 hours of instructional lesson a week. This instruction is made possible by Tennessee teachers. They are teaching Tennessee curriculum through this partnership with PBS. We've also worked to ensure that there's support for early literacy. We've built a partnership with an early education app to provide short videos and free resources for Tennessee families with children from birth to 3rd grade. And these videos focus on topics like literacy and math. These learning supports are built specifically to assist parents and caregivers as we navigate a pause from the classroom. Our department's also hard at work preparing a new funding support. With the passage of the CARES Act, the Department of Education is preparing to deploy one-time relief funds to school districts as soon as those funds from the federal government become available. These federal funds will support meal preparation and distribution, extend learning opportunities for all students, internet and hardware accessibility, and address student needs related to homeless and high mobility populations. So our department is working hard to serve children in every corner of our state. And when I close my remarks, Commissioner Schwinn will add further to those comments. We've talked about the importance of technology as we carry out our fight against COVID-19. We're excited to announce that we're partnering with Nextdoor, the neighborhood hub, to provide official, real-time information to the residents of Tennessee about the state's response to COVID-19. The partnership will allow us to reach thousands of neighborhoods with critical information throughout this unprecedented time. All Tennessee neighbors on Nextdoor will automatically receive messages. If you're not on Nextdoor, you can, and you're interested in joining your Nextdoor neighborhood, you can visit nextdoor.com to download the free app. Now I'd like to ask Commissioner Schwinn, before we open it up to questions, to come up and give an update on what we're doing in the Department of Education.
Good afternoon, and thank you, Governor Lee, for allowing me this opportunity to provide an update. It is my deep privilege to serve the students, the families, and the communities of Tennessee as Commissioner, but I actually wanted to address you as a parent first. The coronavirus pandemic has been personal for many Tennesseans, and the challenges we are facing as individuals are difficult. I'm the mom of 3 young kids, 8, 4, and almost 5 months, and 2 of them are not able to go to school like they used to. I know it is difficult to balance at-home learning, getting groceries, for many of us who are lucky, being able to continue to work, get supplies, and support your families all at the same time. It's your day job, it's your night job, it's your full-time job. My kids, like so many kids across the state, miss their family, they miss their friends, and they miss their teachers. And our teachers miss their kids. Just last week, one of our teachers came by the house and waved to my young Abby from across the window. They talked through the window, but it's not the same. She just wanted to give Miss Kinsey a big hug, and she can't, and that's really hard. This is hard. But one of the things that I know to be true, that I've always known to be true about the state of Tennessee, is that we care deeply about our children. And that is evident now more than ever. In the world of education, and certainly beyond, the public health crisis has forced us to make difficult decisions. Closing school buildings was an incredibly difficult decision. But the health and the safety of our students is the most important thing. Early on, the department partnered with the governor and the Tennessee General Assembly to craft legislation that ensures no student or educator is adversely affected by lost instruction time this year due to COVID-19. We are grateful to the governor and the legislature for their leadership in passing this critical legislation. I'd also like to thank our legislators for being so consistently engaged about the health and safety and well-being of our children during this very difficult time. And as the pandemic has progressed, we know that students are missing classroom-based instruction, and we know that's critical to their development as human beings. But still, our superintendents, our principals, our assistant principals, happy Assistant Principal Week, our teachers, our meal service and nutrition experts, our professionals in counseling and mental health supports, and all of the folks who support our school systems. They've been tackling these new challenges head on. They're working to develop local plans and continue instruction and learning and support of our children, even when our school buildings are closed. What does it look like to provide school-based meals during a public health crisis? What does it mean to provide education, even at a distance, when you can't see your kids in person every day? How do we, under these new circumstances, support teachers who are working incredibly hard to support students? And how do we ensure our students are prepared for the next step? Our work at the department for the last month has been laser focused on our districts and their plans, their local plans to support our students and our teachers to ensure that our children are safe and fed and healthy and cared for. Our teachers have been working incredibly hard to pivot quickly to provide distance instruction for their children who they love dearly. Some of our first steps as a department to respond to COVID-19 and the crisis that we are all involved in involve developing resources, guidance documents, and toolkits. And these are things that districts can utilize and are available online. And those toolkits range from everything from how to support distance learning, how to have meal preparation and distribution at the local level, How do we serve our children with disabilities and our English learners? How do we provide information on internet and hardware accessibility and some of the discounted and negotiated rates that the department has done over the last several weeks? And how do we support our children who are homeless, who have high mobility, and who have additional needs that rely on our school-based services? We have over 1,800 schools in the state of Tennessee. 147 districts support those schools. And right now, we have hundreds of thousands of satellite schools that we're supporting as children learn from home with their families. To support districts as they navigate these local contexts and challenges, we're having conference calls with our superintendents 3 times per week, and we post information around those calls related to what we're able to provide to superintendents and the questions we're getting from them, and all of that is available on our website. We're also having calls directly with superintendents to support localized needs and make sure that we're addressing the individual contexts of our very, very different districts across the state. We're consistently answering questions from our educators, our district personnel, our families, and our communities, again with the interest of children first and foremost. I want to say that even as recently as yesterday, I was on the phone with a number of teachers, including my old kindergarten teacher, Miss McDonald, who is giving me advice on the best ways to support our kindergarten students, especially with learning at home and early literacy. I was on Facebook with one of our excellent counselors who is giving us ideas about creative ways to support mental health with our children, even when we don't get to see them. Our department, but most importantly, our districts and our educators are being incredibly creative and innovative in providing solutions about how we can continue to support our children every single day. Like many districts, we've had to get more creative too. And so a couple of things that we've done. The Tennessee Department of Education, as the governor said, is partnering with PBS stations across the state to offer 1st through 8th grade students up to 30 hours of standards-aligned instructional lessons per week during the time of school building closures. These lessons began airing on Monday, and folks have been really excited about it, my family included. 30-minute segments air from 10 to 12 p.m. every weekday on the main channels and affiliates of PBS across the state. And broadcast programming has been available for English language arts and for mathematics. The lesson plans and student work packets are posted on the department's website for teachers and families and communities to use. The video lessons are also posted on the department's YouTube page as they air. I also want to note that the videos are closed captioned because we want to make sure that these lessons are accessible for all of our Tennessee students. We are so grateful to PBS and to our Tennessee teachers across the state who have done this work so quickly and with so much enthusiasm for what this means for kids. Kind of stepping to the side for a second, I want to say as a mom, I am also very, very grateful for the work that has happened with the PBS partnership. My daughter Ellie watches them every single day. It's something that we get to do together. And even though she cannot see Ms. Schultz, her teacher, in classrooms, it gives her some level of comfort to be able to see the carpet and the whiteboard and a teacher doing the same thing she could expect even if school buildings were open. So thank you to those Tennessee teachers. As one mom in the state, this means a lot to our families. Another important partnership that we secured related to early literacy, and that's the Ready Rosie app. We secured a statewide partnership with Ready Rosie, an early education app to provide short videos and free resources with simple, engaging activities for Tennessee students from birth to 3rd grade. Ready Rosie, the model movement, videos, they're simple, they're fun, they're easy to use. We have over 3,000 folks who are already signed on, and they're quick 15-minute activities that you can do at home with your children. And I will say, me and my little Abby, we do that every day, and it's something really exciting. It comes to your phone, you get to take a moment, and it's something special she gets to do with mom and dad. They're great ways to support early literacy at home, even when our school buildings are closed. In addition to the great programming that's happening in schools and districts and at the Department of Education, we also have state-level supports, and the department has been focused on positioning our state to receive federal funding through the CARES Act. The CARES Act does provide $2 trillion in emergency relief funding related to COVID-19, and $30.75 billion is nationally given for the education stabilization funding. Through this legislation, Tennessee school districts are eligible to receive one-time relief funds allocated based on our Title I formula percentages. Each state is required to submit a plan that the U.S. Department of Education must approve, and we expect those applications to be available by mid to late April. To gain as much input as possible for this one-time relief funding, the department has launched 2 surveys, one public survey and one specific to superintendents, to get broad stakeholder feedback and to inform our state's application. We are also getting feedback through emails, through calls, and through continuing engagement with all of our stakeholders. Due to the timeline and our absolute commitment to get resources to districts as soon as possible so they can continue to support our children, we are asking for feedback to be submitted by the close of business on Monday, April 13th. As we look at what comes next, we'll continue to do all that we can to support our schools, our educators, and our children. We've got to take care of our kids, and I want to personally thank every single school stakeholder, our superintendents and principals and teachers, the folks who are distributing meals every single day to our kids, ensuring that our kids are fed and safe and healthy, our school counselors, our special education teachers, the folks who are driving buses and dropping off meals and work packets, and our community members and volunteers across the state who have put the focus on kids where it belongs. The way that you have stepped up for our school communities continues to be awe-inspiring, impressive, innovative, and important. Our kids are counting on us. They're always counting on us. And it never, ever, ever crossed my mind that the folks who are working in our schools every day would do anything less than what they are doing now. Our state is about kids, always has been about kids, and our districts are doing incredible work. As a state, we will remain focused on this. As families, we will get through this together, and we are going to be better for it. I just want to say thank you one more time to our school communities. You're doing a great job. Keep it up. Thank you very much.
Thank you, Commissioner Schwinn. We very much appreciate that. We're very much committed to, as you can see, her passion for, but our commitment to our children in this state and to our families through our educational efforts. Okay, Dr. Piercy, I'd like to ask you to come up and give a health report, and then we will answer questions.
Thank you, Governor. Good afternoon, everyone. As the Governor mentioned, we have 4,634 cases, which represents a 6.2% increase over yesterday. The good news is we are approaching 1,000 people that are in the recovered state, and that number continues to grow. The other number that we're proud of is that our testing numbers are approaching 60,000 and growing by the day. A couple of data points that you may want to draw your attention to. Even just since yesterday, we have had improvements in our race reporting, and so those updated numbers on our website. And then new today is a posting of deaths by age. Unsurprisingly, you will notice that over 80% of all of the unfortunate fatalities we have had have been in the 60-plus age range. That breakdown is also on our website today. I want to take a moment to talk about modeling, because that's something that a lot of people are looking at and are concerned about. But I want to tell you from a physician's standpoint and from a hospital administrator's standpoint how we interpret that. You know, models vary widely, and they're just that. They're predictions based on usually historical data. And when we're looking at our planning efforts, we look at many, many data points, and this is just one of them, is modeling. But I can tell you the most important data point is what we see on the ground. And as I referenced, I did function as a hospital administrator for almost 10 years prior to coming into this role. And I can guarantee you that every single day, I knew and all of the hospital administrators know exactly what their resources are that day and what they can leverage if they need to surge. This is why we use the most important data point as communication with hospitals, both individually and through the hospital association, as well as through our resource tracking system that you've heard me talk about called HERTS. So I just caution you to look at all the different models and use those as data points to inform you, but not to rely upon those exclusively. We're taking that same approach. Finally, I want to tell you about a couple of things to expect tomorrow. So tomorrow we will be publishing for the first time the nursing home list. This is something that we've referenced in previous days, and as pursuant to a letter that I sent out a couple of weekends ago to all long-term care facilities, they are now required to report to the department anytime there are 2 or more cases of COVID-19 in residents or in staff. So starting tomorrow, you will see a list of these facilities that have reported to us posted on our website. I do want to remind you, this does not necessarily infer any type of wrongdoing. This is just facilities that have had positive cases. As I've said sometimes, even the best laid plans and the best practices still can't prevent all cases from coming in, so I will give you that caution when you're interpreting that list. Finally, tomorrow we are going to do 2 mass testing events in 2 of our correctional facilities, Bledsoe County Correctional Facility and Northwest Correctional Facility. I want to emphasize that the testing will be amongst staff. We have not had any confirmed cases in inmates in either one of these facilities, but we have had positive staff as well as positive exposures in both of these facilities. Interestingly, we identified this link through our very robust contact tracing methodology, and so you will see our National Guard partners being in those facilities en masse tomorrow to do all of the staff testing. It's going to be a few days before we have results on that based on just the sheer number of tests that we're performing, but those will be occurring tomorrow. I'll stand by for any questions you may have.
Thank you, Dr. Piercy. Commissioner Schwinn, I remind everybody for questions that we have members of our Unified Command Group here to answer any questions about procurement or surge or capacity. So we're happy to open it up to questions.
Thank you, Governor. First, we'll go to Kim Crucy with the AP. Kim, your line is open.
Hi, Governor. Thank you for doing this today. Yesterday, a Congressional House Oversight Committee basically reported that the national stockpile for PPEs and ventilators has been heavily depleted. I was curious how much Tennessee has been made aware of this depletion of the national stockpile and what the state is doing to make sure that it's not relying on the federal government as much to get as needed supplies as possible.
I'm going to let our director, Patrick Sheehan, the director of TEMA, who's really, his team is most responsible for the procurement of PPE and the interaction with the federal government on national stockpile, to talk about our efforts and specifically to talk about your question.
Thank you, Governor. Thank you, Kim. So, ventilators obviously are in short supply. I think Dr. Fauci spoke sometime recently about how there were 14,400 ventilators in total in the SNS stockpile. And if he had it to do over again, he'd probably buy 100,000. But when you're doing planning for these things, that's not necessarily what you're looking at. So you're trying to make good decisions. My counterparts in the other states, Dr. Piercy's counterparts in other states, have all pressured the federal government to go ahead and push everything they can out so that we're not holding things back when there's a need. And so there's an acute need in New York State, for instance, for the SNS stockpiles ventilators. So rather than trying to hold any of those back, go ahead and push those to where the need is and allow the supply chain to catch up with the other needs that might come up later on with ventilators, and also to states are sharing these things. So I know, for instance, through the Emergency Management Assistance Compact, which is managed by the 54 states and territorial emergency managers in the nation, California was able to share ventilators with New York State, Delaware, and some other places that have far worse impacts from COVID-19 than we're experiencing here in Tennessee. So we're tracking those things, and those things are being communicated with some regularity.
Is that something that Tennessee, I'm sorry to interrupt just so quickly, is that something that Tennessee is looking to pursue, maybe do some sort of state sharing like what California is doing?
As we continue to look at these models, we're of course willing to help. We're oftentimes one of the, in terms of per capita of the amount of resources that are shared and teams that are sent to respond to hurricanes and anything else, Tennessee leads the way. And in this pandemic, if we're sure that Tennesseans are being taken care of, we would, I think, pursue that same course of action.
Yeah, we haven't done that yet, Kim. We're still waiting for our surge and looking at what that is going to look like for our state. We want to make sure we have the equipment we need here, but if that time comes, we certainly would be happy to help.
Thank you.
Next, we'll go to Natalie Allison with the Tennessean. Natalie, your line is open.
Hello, Governor.
Hey, Natalie.
The Vanderbilt projections that came out today show a possible peak in June or May, which is unlike the Washington model, which of course shows mid-April. How does that information at this point impact your planning? And I know there had been discussion about potentially creating a hybrid of those models in what you all were doing. So can you speak to that?
Yeah, every time we get a model, it gives us a little more information, and that one does. And I know you've looked at it, and it has it has scenarios for different actions taken or different outcomes. Those are all helpful. They will be used as we daily try to understand what we think is going to happen in the days ahead. We're continuing to plan for a surge. We want to make sure that we have capacity. We want to make sure that we're ready for what's coming. Exactly when that surge is or how big it is, we don't know that yet. I will say that one of the more helpful pieces of data, and Dr. Piercy alluded to this earlier, the further we get into this, the more we know about actual hospital bed capacity and what's going to happen and what is happening as a result of some of the actions we've taken. So, for example, suspending elective procedures clears and frees up hospital beds, and we know that because we have a lot of hospital capacity right now that's unused. We have major healthcare companies that are furloughing employees right now in our state because of the lack of activity in our hospitals all across the state. So communicating with them directly, which we do on a regular basis through the Tennessee Hospital Association, and also directly with hospitals to know how many beds are actually available today, that informs our decision as well. The further we get into this, the more real data we have and the less projected data we have to use. But I will say that model will certainly help us as we plan for the surge.
And Governor, we're about 5 days out from your safer-at-home order expiring. When can folks expect you all to make a decision on whether that's going to be extended for the purposes of businesses planning, whether they can reopen, people going to work, et cetera? Do you have any sense of when you'll know when that decision will be made?
Well, we just watch the data every day, and we'll make a decision certainly before it runs out. We'll let people know what that decision is, but data changes quickly, as you know, and numbers change quickly. This new model just came out today. The Washington State model was updated on Wednesday. Hospital counts are changing every day, and our numbers are changing as well. So what we're most interested in is making the right decision at the right time, and we don't want to make a decision before we should. That's been a very difficult thing to navigate through, but that's been the approach, and that'll be the approach this time. So we'll certainly announce before the date comes, but no plans about specifics yet.
Thank you.
Next, we'll go to Hannah Wall-Smith with WMC. Hannah, your line is open.
Hey, Governor. It was mentioned yesterday that American Family Clinics are offering the 5-minute rapid COVID testing, and it appears that there's only one of those clinics in the entire West Tennessee versus several in Middle and East Tennessee. Since Shelby County, Tennessee has the most cases of COVID in the state, is there any priority here in this side of the state?
Well, we want to make sure that every community has access to testing. We have made very strong efforts in every community, including Shelby County. Significantly, your private providers there as well are providing significant testing opportunities. We are trying to get into every neighborhood and are in neighborhoods. We're utilizing nonprofits in neighborhoods to reach out to encourage people to get tested. That particular company and that Abbott Lab machine and testing capacity they have, that's a private company. Their facilities are, their facilities are limited to where they have those private facilities. But we know that there's going to be more of that Abbott testing coming online in the next few weeks that'll provide for point of care testing in a lot of places across our state. But we're committed. We're committed to testing. We're committed to testing in every part of the state, and we have we've ramped up that and made widespread testing available. And let me say this, we're not aware right now of any testing facility that is turning away people who request a test. Now, these of course are people who qualify for a test and who have been referred to a test or are presenting with the appropriate symptoms, but we're not turning away people for tests right now. And if we find a place that is, or if there is someone out there who, if there are folks out there that are being turned away, we want to be made aware of it, because we're trying to get ourselves in a position where folks are not turned away, and in fact, developing strategies to ramp up testing significantly all across the state. So we have a strong commitment to it.
Thank you. And can you specify any locations of the 35 care sites that you announced Monday? Are those any of those in Shelby County or Memphis?
Health department, if they're available to be seen on the Tennessee Health Department website. And there's a health department, there is testing at every health department in every county in the state. So as well as a number of other opportunities to have testing in Shelby County. So that information is available on the website.
Thank you.
Thank you.
Next, we'll go to Sam Stockard with the Daily Memphian. Sam, your line is open.
Yeah, thanks, Governor. Now, we've been asking some of the Memphis hospitals for information on the numbers of beds, ICU beds, and ventilators used by COVID patients specifically. And they say they have that information, but that the state has told them not to release the numbers. Is the state telling them not to release that? And if so, why? Because wouldn't it help local officials make better decisions?
Yeah. Dr. Pierce, you want to answer that?
Sure. On hospital level reporting, we have not given any mandate to not share that information per facility. If facilities want to share that, they're welcome to do so. Their general, what we call sunny day capacity, is widely available. That's publicly reportable. We report information on an aggregate basis statewide, but if facilities want to share that themselves, there are no restrictions from us to do so.
But has there been any encouragement for them to do that?
It's always been up to them. We have neither encouraged nor discouraged, but if they find that a useful data point to share, they are encouraged to do so.
Okay, thank you.
Next, we'll go to Jason Lamb with News Channel 5. Jason, your line is open.
Thank you, Governor. Staying on the line of questioning just about testing, the Trump administration has said it's pulling back federal support for the FEMA-administered community-based testing sites. I was wondering what impact that's going to have here in Tennessee and testing that's going on here.
You know what, Patrick, I'll let you make a comment on that. Patrick, our TEMA director who works with FEMA, but we don't believe there's going to be any impact, particularly in light of the fact that we're expanding our testing efforts across the state. But you want to comment on that?
Yes, sir. So our testing in Tennessee has been done, local health departments, the Tennessee Department of Health and the National Guard, along with private providers. We have not had, in Tennessee, we've not called upon the federal government to assist us with our testing. We've used resources. We've asked for federal support with getting some testing supplies occasionally, but these have been Tennesseans and Tennessee companies supporting our testing efforts.
Great. And Governor, I also wanted to know, just with so many people out of work right now, so many unemployment claims being filed, we've seen the jobs for TN site facing computer system failures. How accurate do you feel that Tennessee's reported unemployment rate is right now? Do you have a sense that it might actually be much higher than what the data shows because so many people are having problems getting their claims through?
Yeah, let me first just say, we know what a challenge it's been for those who are trying to file for unemployment through the state. We are aware that that's created a great hardship for people. We're working really hard to overcome that, but we acknowledge and we know that that's been challenging. As you know, we're having 25 times more filings than we have, than we traditionally have. That's put an enormous strain. We have, significantly increased our resources, gone from 20 folks to I think 250, and we're working to upgrade that system. So we're working hard to change it, but we acknowledge and we know that that's been a real struggle for folks. We do think the data is appropriate and information is correct, because we have, to the degree that someone actually files the claim, we know that we capture that data, but we certainly will continuously look at and make sure that our data is accurate. And the biggest goal for us is to make sure that Tennesseans can get those claims processed more quickly, and that we can actually get those payments out. We're merging the federal dollars with our Tennessee dollars, the unemployment from both of those programs into one. We're working hard to get it done. We hope to. We know we've had problems, but we're getting there.
Next, we'll go to Larry Stone with 94.1 in Cookeville. Larry, your line is open. Larry Stone, your line is open. Okay, we'll continue on. We'll go to Sergio Martinez Beltran with Nashville Public Radio. Sergio, your line is open.
Thank you, Gillum, and thank you, Governor. I do have a question. Governor, you've talked a lot about, the self-employed and how the state will be helping them through this process. But can you talk about specifics? What is the state going to do with people that are self-employed?
Well, what we talked about specifically yesterday was clarifying and making certain that those who file 1099s and who are self-employed, that they can apply for the same unemployment benefits that any other displaced worker can. There was some uncertainty about that, and that actually it required guidance from the federal government in order for us to opt into that program, but we have. That specifically is what we talked about yesterday. I think that answers your question.
But yesterday you talked about how the Department of Labor was changing some codes. I want to make sure I got that right.
Was what, Sergio?
Yesterday you mentioned that the Department of Labor was changing some codes to make sure that the self-employed qualified.
I know we just actually had to opt into the federal guidance and make sure that we followed the steps so that they could in fact apply and receive those same unemployment benefits, and they will be able to do so. And one of the things we said was, if you are self-employed and you filed for unemployment, you're logged into that, so there's no need to go back and refile. You'll receive those benefits just like any other displaced worker will.
Thank you.
Mm-hmm.
Next, we'll go to Andy Scher with the Times Free Press. Andy, your line is open.
All right, thank you. Commissioner Piercy, getting back to the testing, this Vanderbilt model was saying that social distancing is working. However, it says that if you all get this up too soon, there's going to be a surge, and hospitals are going to be hard pressed, and as many as 5,000 beds being filled. So I realize that you were saying that there are different models, but how much are you taking that into consideration?
That actually brings up a good point that I should have mentioned earlier, and I didn't. Every model, depending on, and no matter what you look at, there are assumptions made in those models. And I would encourage you, when you're looking at any of those, to look at that fine print and the assumptions that are made. Specifically as it pertains to the Vanderbilt model, we've been in communication with the experts there last night and today about the new data that they added for what is to happen in June if social distancing measures are reversed. It's our understanding, and this is subject to change based on further conversation, but it's our understanding that that model that projects a big surge in June is contingent upon complete reversal of the current social distancing practices. I don't believe anybody expects that to happen. But it's really hard, and I did reference earlier about modeling being based on previous action and historical data. So it's really hard to predict what somewhere in the middle would look like as we think about, and as everybody in the nation is thinking about, how do we incrementally bring these things back online? So it's sort of an all or none scenario, and so we expect, based on what social distancing efforts are maintained or are relaxed, it to be somewhere in the middle.
Well, I mean, that was, if I could follow up, that's exactly what they were saying, that it could be, you know, it wouldn't be that bad. But again, that all hinges on you all continuing this order to the extent that you have, does it not?
So what we're looking at is where does that fall in the middle? It's not all, it's not none, and how we can ratchet up our efforts to open back up the economy while still maintaining a reasonable epidemiological curve. So your point's well taken. It's not going to be all or none, but we are looking at how we can do that incrementally.
Thank you.
That's all the time we have for questions today. Governor, if you would like to make a closing statement.
No, thank you all for being here. Thank you for all of you who joined and questions you answered. Remember that we are all in this together. You, every single person listening here, has a job to do out there, and that's to continue on the same path that we have. We are encouraged with the direction that things are moving, albeit slow, but we're moving in the right direction, and it's because of the efforts that you have made. Continue to make those efforts, continue to work together, and we will get through this together. As we observe Good Friday tomorrow, we will not be having a briefing on tomorrow afternoon, but we'll be back on our regular briefings on Monday. Do your part and stay apart. Thank you.